The universal and area-specific curates are indicated for scaling and replaning, supragingival and subgingival calculus removal. And contraindications would be for patients with bleeding disorders or patients that are taking anticoagulant medications. There are risk of excessive bleeding. Also for patients that have implants, there are special instruments for implants. And also for acute infections or abscesses, we should avoid using these instruments. And we also have to be careful when there are restorations like crowns and fillings, and it's better if we use horizontal or oblique strokes. I have here the universal curate and also 3 area specific curates. This one right here is the Bernhardt 5.6, and the parts of this instrument are the handle, the shank, and the working end. If we take a look to the working end, we can see that the face of the blade is angled 90 degrees in relationship to the lower shank of the instrument. This instrument is double-ended and it has 2 cutting edges one on each side of the blade. This instrument can be used for supragingival and subgingival calculus removal. It can be used on anterior teeth and posterior teeth, distal surfaces, mesial surfaces, vocal and lingual surfaces. To find the correct working end of this instrument, we are going to place the tip of the instrument interproximal, and we can see that this way is like hugging the tooth, so that's not the correct way. Now we're going to place the tip of the instrument interproximally, and we can see that the lower shank is parallel to the long axis of the tooth, so this is the correct working end for posterior teeth. When we are using the universal, we're going to start from the most posterior tooth forward. So we start from the most posterior tooth at the distal line angle, and we instrument full interproximal. Then we go back to the distal line angle, and we instrument toward mesial. And when we're doing the lingual side, we also have to check the correct order. So in this case, this will be the correct order. You can see that the lower shank is parallel to the long axis of the tooth. And we place it again at the distal line angle, and we instrument toward distal, and then back to the distal line angle, and toward mesial. We're going to close 0 to 40 degrees. We're going to insert, and we're going to open. We close so we avoid tissue laceration. Close, insert, open, and we instrument. To find the correct working end for the anterior teeth, we can place the instrument. If we're working toward surfaces, we can place the instrument, and we can see that this one is hugging the toward surface, and this side is hugging the away surface. We can also use Pac-Man. If we're working in away surface, Pac-Man is eating away, and if we're working in toward surfaces, Pac-Man is eating towards. For the anterior teeth also, we are going to start from the midline of the tooth. Not at the distal line angle, it's at the midline. Close, insert, open. So these are area-specific curates. We have the Gracie 1314, which is for posterior areas. We have the Gracie 1112 for mesial areas. And we have the Gracie 12, which is only for anterior teeth. First, we can see the Gracie for posterior and mesial and distal areas. The difference between the Gracie instruments and the universal, we can see the lower shank. The parts of the instruments are the same: handle, shank, working end. The difference is that the working end, we can see that the blade of this instrument, I don't know if you can see it, but it's not angled 90 degrees like the universal. This blade is angled 70 degrees in relationship to the lower shank. Same with the 1314 Gracie, 70 degrees in relationship to the lower shank. Another difference is that these instruments also, they have only one cutting edge, which is the lower cutting edge. One side is higher than the other one, so the one that is lower, that's the one that we are going to use towards the tooth surface. And for the universal, it was two cutting edges. But these instruments are also used for supragingival and subgingival calculus removal. And they also have a toe, a rounded toe, indicating that they are used subgingival. Okay, now how are we going to use these instruments? The same as with the universal. P to the D, we're going to close, 0 to 40 degrees, we're going to insert, we're going to open, and because this instrument is already angled 70 degrees, we don't have to angle this instrument, because as long as the lower shank is parallel to the long axis of the tooth, the working angle is already created. It's not like with the universal, that is 90 degree, the face of the blade is 90 degrees angled to the lower shank. So we have to create a working angle by slightly angle the instrument towards the tooth surface in order to activate it or scrape. So we close, we insert, we open, and we activate the instrument towards the saw. We start from the most posterior tooth forward. Same with 11-12. From the most posterior tooth, mesial surfaces forward. And for anterior teeth, from midline, we work away surfaces, and toward surfaces, canine to canine.